Hello everyone. So, I am again here to discuss a topic on concept of health and disease. Today I am doing the part number 3 in continuous with the part number 1 and 2, in which we have discussed about the concept of health and diseases, what are the definition, multidimensional aspects of the disease. Then after the health philosophies, we will come up with some other levels of prevention of the diseases. Okay. So, we will start with the topic of the control of diseases. Okay. So, the disease can be controlled by sequence. Okay. First we will target on the disease control, after that we will eliminate the disease. Okay. Then there is the last stage, we call it as eradication of the disease. Okay. So, there are some differences between these of the stages, and of course, the timing of the implementation as well. So, we will start with the disease control, which is primarily refers, so this term the disease control, it refers to the primary and secondary level of prevention. Okay. There are different level of prevention. In tertiary, we have not included here tertiary level of prevention. So, basically I am just giving the idea of the tertiary prevention. In the tertiary prevention, we are eliminating a disease in the complication part. Okay. So, if we are talking about the disease control, of course, we are targeting the early stages. Okay. So, disease control, that is why it is referred as the targeting the disease on the early phases, the primary or the secondary levels. Okay. So, this is a sequence of the first sequence is the disease control. Okay. Then we will eliminate the disease. Elimination generally means we are eliminating a disease from a particular area. Okay. So, this is a geographical term elimination. Then it will eliminate the disease from whole of the world. Okay. So, we will call it as eradication. Okay. So, we will do one by one what is the differences here. Under the concepts of control of disease, disease control, which is known as reducing the transmission. Okay. So, transmission of a disease agent to a low levels. Okay. So, that we can stop it to the public health. So, it cannot reach out or it cannot spread to the to whole of the community. So, we are controlling it. Okay. So, it aims at reducing, we want to decrease the numbers of the cases. So, incidence of diseases, or we are of course reducing the duration of the disease. Okay. Of course, we are implementing here the treatment at the early stages. We do not want it to be complicated, or we do not want it to reach to the tertiary level. Okay. So, that is why it is taken under the primary or the secondary levels of the prevention. Then effects of the infection. Okay. So, what we can do, we can eliminate the agent. So, if a mosquito is causing any infection, so that is a vector here, mosquito is causing malaria. Okay. So, we are eliminating these vectors, we can implement the treatments, of course. Okay. So, these are some part under the effects of the infection. Then financial burden of the community, of course, if we will do all of these things, we can reduce the financial burden of the community. So, this is how we are controlling. So, controlling part is very important. Okay. Then after that is the disease elimination. Okay. This is the second stage, we can say. So, disease elimination, if we can control the disease, of course, the next step is to eliminate the disease. Okay. This is the complete interruption of a disease in a defined geographical area. The very initial I told you, of course, this is a geographical term. Okay. So, in a particular area, the disease is absent. Okay, just because we have interrupted the agent which is responsible for the disease. But the causative organism may be persisting in the environment, of course, it is present somewhere. Okay. So, disease elimination is a geographical term, it can be used for the country, it can be used for the region. Okay. So, maybe the India has eliminated a disease, but maybe some other countries they have this disease. So, elimination is used at the country level or as well as for the region. So, we can for the region we can take an example like Uttar Pradesh or Delhi has eliminated this disease. Okay. So, this is a regional wise we can say also. India has eliminated 4 diseases till date. What are these diseases? These are important data, you should keep note all of these data. So, guinea worm, okay. This is also known as trichinochiliasis. India has eliminated this disease, but we are not taking the term here as eradicated, because maybe some other disease, other countries they have this disease. Leprosy, we have eliminated it in December 2005. Okay, yours is also one infection, we have eliminated it into 2016. Then maternal tetanus and neonatal tetanus, NNT and MT, which is very much responsible for causing maternal and infant death. Okay. That is why we have a program for tetanus injections we are giving at the time of the pregnancy. Okay. So, maternal and infant death. Okay. So, we have also eliminated these 2 things. Then what are the other diseases that India is planning to remove or to eliminate is the poliomyelitis. Okay. In the poliomyelitis we have a different strains, okay. Polio 1, poliovirus 1, poliovirus 2, poliovirus 3. Okay. So, all of these 3 strains have not eliminated till now. So, we have a plan for eliminating all of these strains. Okay. Then Kala Azar we are targeting, the India is targeting, means lymphatic filariasis. These 3 diseases we have in the next target. Okay. Then there is a term, the next stage after the elimination we are approaching for the eradication. Okay. So, we want the complete extermination of the organism. Okay. It means disease it not present. Okay. So, we are killing it by uproot. Okay. So, we are tearing out by roots of a disease. Okay. So, this is all or none. This concept means all or none, either it is present or not present. Okay. So, exhibit all or none phenomena, important point here. Okay. Disease eradication is a global term, I already told you. Elimination is a geographical term, whereas eradication is a global term. It will eliminate the disease from whole of the world, we call it as global. Okay, global term, we will use the disease eradication. So, that is can be used only for whole planet. So, which disease the world has eradicated, you all should know. So, world has eradicated one disease till date. What is the disease here is the smallpox. Okay. In which year we have declared, the world has declared in 1980 that yes, now no country is with this disease smallpox. Okay. Poliovirus, so poliovirus is also eliminated, but I told you poliovirus has different strains, poliovirus 1, 2, 3. So, poliovirus 2 was eradicated, but we have left, means whatever the virus strains left is the poliovirus 1 and 3. Okay. So, we are targeting to eliminate all of these, and will eliminate from whole of the this world, will put it into the eradication of us. Okay. So, poliovirus 2 was eradicated in 2015. Then what are the other targets the world has for eradicating is the polio. Okay, that is why we have mentioned polio here, because now we have left on these 2 strains. Then measles and guinea worm. Okay. So, this is these important points you should keep note, that which diseases the India has eliminated and which the world has eradicated. Then there is a concept of surveillance under the concept of health and disease. Okay. Any program is successful while doing a good surveillance. Okay. Now, surveillance is a very broad term. Okay. Under this we will see the monitoring. Okay. So, in the next slide, we will see the differences between the monitoring and surveillance. Before this, we will see the definition of the surveillance and what are the types of the surveillance here. Okay. So, surveillance is an ongoing systematic collection and analysis of the data, okay, and the provision of information which leads to the action being taken to prevent and control of the disease. Okay. Very simple term. This is usually one of an infectious nature. So, what we are doing, we are controlling the disease by doing the proper or good surveillance, and this surveillance needs a proper proper collection of the data. Okay. Data should be correct, okay, it should be collected, everything should be notified. Okay. There should be use of information and communication. Okay. I and C, T, this should be used, information and communication technology, then only we can improve all of these things. Okay. Then in the surveillance is of many types, there are 3 types here. You can see passive, active and sentinel. What are the difference here? In the passive surveillance, what happens? Data is itself reported to the healthcare system. So, I think you have seen this type of system in most of the cases. What happens? The patients are going to the hospitals, the patients are going to these healthcare centers, they are approaching to these healthcare centers, and they are telling about the problems, the follow-ups if they are doing. So, the data which is reported in that manner, we call it as a passive surveillance, where the patients are approaching or the consumers are approaching. Okay. Active surveillance, for some of the diseases we have seen in the initial, of course in the COVID we have seen the healthcare officials, they are coming to door and they are checking for the health status. Okay. So, this is under the active surveillance, where the healthcare professionals, they are actively going house to house survey, they are going in a community, they are checking the cases or notifying it. Okay. So, in the active surveillance, health system seeks out actively the collection of the data, they are goes out to the community to collect data. So, there is one example here, National Vector Borne Disease Control Program, okay, NVB DCP. So, every years we have seen in India, for many states there is an outbreak of dengue cases. Okay. So, this requires the active surveillance. Every year the health officials, they are going to different areas and they are checking out the cases, they are taking all of the measures which are required to reduce this outbreak or to spread of the transmission of disease. Okay. Then the third is the sentinel surveillance. Okay. Sentinel surveillance is required for some of the cases where we are trying to find the missing cases. Okay. So, we are notifying the missing cases and supplementing the notified cases. So, we are approaching some of the healthcare centers it is under the NACP, National AIDS Control Program. Okay. So, if we want to find out the HIV patients, so which of these centers we will go? So, we will approach the STD clinics, okay, sexually transmitted diseases or reproductive transmitted diseases clinics. Okay. Here we can find those of the missing cases or the contact tracing also we can do. Okay. Then ANC clinics, antenatal care, okay, pregnant women, they are also prone to give this infection to their babies. So, this is also one of the target healthcare officials can approach to these targets to notifying those of the missing cases. Okay. So, that they can plan the treatment as early and can reduce the diseases. So, they all are under the sentinel, they are known as the sentinel sites. Okay. These sites like STD clinics or ANC clinics to monitor all of the trends of the diseases. So, they are sentinel surveillance is only for some of the specific diseases where we try to find out the missing cases and to notify them. Okay. This is all under the surveillance. After that, we will see the difference between the monitoring and the surveillance here. So, I told you before starting the differences, I will tell you a very short definition here for the monitoring and surveillance. Monitoring is a small subset of, okay, of surveillance. So, monitoring is, you can say it is a smaller concept. Okay, it is a part of the surveillance. There are two terms here, monitoring and surveillance. So, please just do not be confused with it. Monitoring is only a small part of the surveillance. It is monitoring is a very smaller concept which we are doing from the starting of the diseases to the end of the diseases only. Okay. Whereas the surveillance we are doing even after the end of the diseases. Okay. So, surveillance is a very broad aspect, very broad topic. We will see the comparison here. So, monitoring, it is a performance and analysis of routine measurement, okay, aimed at detecting changes, what are the changes a patient is with on a daily basis. Okay. in environment and health status of a population. If a person is suffering from any of the disease or taking a treatment, what are the changes the patient is coming with, okay, and how we can improve it. So, after monitoring, of course, we are changing the treatment, we are changing the individualizing the therapy as well, okay. Then in the surveillance we can see what is in difference. Continuous surveillance is a continuous scrutiny of the factors that determine the occurrence. So, we are even seeing the cases, when the cases are coming, we will start from the cases, okay. What is the occurrence, what is the distribution of the diseases and the other conditions of the ill health, okay. This is the comparison here. Then monitoring is a one time linear activity, we did it only a one time. Then surveillance requires a continuous cycle, okay. In monitoring there is no feedback present, okay, whereas in surveillance will do the feedback also, okay, even it tells after the end of the disease, okay. There is no inbuilt component required, but for the surveillance we have the inbuilt action component present. We are changing the plans or we are implementing the plans, okay. Then in this, stop once disease is eliminated and eradicated. I told you monitoring will stop the monitoring part, okay. With the surveillance we are continuing it. So, this is a cycle, okay, till to the disease end, will yes continue it. If any cases are coming, we will see it again, we will try to change some of the therapies, we are planning the new things which we can do to reduce all of these things, okay. So, monitoring ultimately what we are concluding here, it is a smaller concept, okay, and whereas the surveillance is a broader concept. So, monitoring is a small subset we can say in the surveillance part, okay. Then levels of prevention, okay. So, in the levels of prevention, how we can prevent disease to reach it further to a complications. So, see, we are doing the levels of prevention in these stages, okay. First is the primordial prevention, secondary is the primary prevention, then coming with your secondary prevention, and ultimately is your tertiary prevention, okay. So, we will start with a one to one, primary, primordial, primary, secondary and tertiary. So, start with the primordial prevention. This primordial prevention, it is a very new concept, okay, and in this we are receiving special attention in the prevention of the chronic diseases. We do not want patient to come up with the chronic diseases. So, we want the primordial prevention in those of the patients, means those of the people, not the patients, okay. They are not the patients, they are the only a healthy person. So, we want them to be healthy, okay, for a longer times, to take these by taking these primordial prevention steps, okay. So, this is the primary prevention in a purest sense, okay. After that we will see there is a second definition, there is a second stage is called the primary prevention, but this primordial prevention is a purest sense, we will say yes, this is the primary prevention, okay. So, we are preventing the emergence of the risk factors. So, we are controlling the risk factors, not the disease. So, this is why we are saying it is a purest sense of the prevention, okay. We are reducing the emergence of development of risk factors. So, what risk factors we will prevent? So, will decrease the obesity, okay, will decrease the cholesterol level of the patient. So, these are some of the risk factors which are causing the hypercholesteremia, which are causing the obesity, coronary problems, okay, heart diseases. So, here in the primordial prevention, what we are doing? We are preventing the risk factors, we are approaching to the risk factors, okay. For example, many adults health problems like obesity, hypertension have their early origins in the childhood, okay. So, because this is a time when the lifestyles are formed. So, what we can do? We can impact on the lifestyles. So, we are giving the counseling to the people to avoid the smoking, okay, not go for the smoking, eating properly, following the healthy diets, okay, physical exercise, these all are under the primordial prevention. So, you call it as a health promotion strategy. How you can promote a healthy lifestyle, okay, health promotion strategy. So, health promotion strategies are part of a primordial prevention, okay, where we are targeting on the risk factors. I hope this is clear to all of you. Then there is a primary prevention. In the primary prevention, the risk factors are present. Okay. Now, the person is obese, okay. Now, the person has a high cholesterol level, the person is not following healthy lifestyle. Okay. So, risk factors are present, but disease is not present. Okay. Till now we do not have disease. Okay. So, this is under the primary prevention. What we are doing to reduce the diseases. Okay. So, primary prevention can be defined as an action which is taken prior to the onset of disease. Okay. Now, disease, we want to eliminate this disease, which removes the possibility that the disease will ever occur. Okay. So, see, there are some interventions. Intervention in the pre-pathogenesis phase of the disease or health problem. So, low birth weight, we know that in India, means we have seen the babies, they are low birth weight. Okay. If we have some ideas, yes, there could be the chances of low birth weight. So, what measures we are doing so that there would not be a low birth weight delivery. So, this is under the primary prevention, means we are exposed with some of the risk factors. Now, we are trying to eliminate these things so that we will not go for the diseases. Okay. So, will not get these diseases. So, WHO has recommended some of the approaches here. There are some population strategies and high risk strategies. Okay. Either we can approach to the mass level, means all of the peoples we can approach, okay, and also we can approach the high risk strategies. Okay. So, means of course, there are some peoples we are targeting, okay, not all of the. So, they are under the high risk. Okay. So, in the primary prevention, what we have concluded, means whatever the interventions we are planning after the person have the risk factors, so that we can eliminate the disease. Okay. Then under the secondary prevention, in the secondary prevention the person has disease. Okay. We are on the step of the disease. Now they are patient, they are called as patient. Okay. So, secondary prevention can be defined as an action which is halting the progress. What we want, now the person has a disease, the patient has a disease, but we do not want to complicate it. Okay. So, we want to reduce the complications. Okay. So, to reduce the complications, we want early diagnosis, we want early treatment. Okay. Or what other thing we can do is the early diagnosis, and apart from the early treatment, we can reduce some of the means to reduce the complications as well. Okay. So, specific interventions are early diagnosis like screening test, then case finding programs, and will start the treatment of the patient, so that the patient will not proceed with these complications of the diseases. Okay. Then another is the tertiary prevention. Okay. Tertiary prevention means the person has a disease, yes, okay, means now we call it as a patient, and they have complications as well. Okay. So, we are trying to reduce those of the complications, so that we can help the person in the terminal stages. Okay. So, that the person will not reach out in the terminal stages. So, when the diseases process has advanced beyond its early stages, okay, it is still possible to accomplish the prevention. So, we call it as a tertiary prevention. We want to reduce those of the complications. Okay. It signifies interventions in the late pathogenesis phase. Now, it is on the higher levels. Okay. So, what we can do, we will limit the impairments. Okay. Sometimes what happens, the person is suffering from any disease and there are complications like there is the quality of life is impacted. Okay. Or the person has disability, the person is not able to do daily activities. Okay. That daily activities are compromised. So, we can limit those impairments. Okay. We can reduce the disabilities which are associated with any disease. Okay. We can minimize the suffering of the patients. There are some diseases like cancer, okay, it is on the phase 3 or 4. okay, very severe diseases. So, we can treat those of the complications, okay, which are associated with these severe diseases. So, we can minimize the suffering caused by existing departures from the good health, okay. So, to promote the patients, and we can adjust it to irremediable conditions, okay. Then in all of the levels of prevention, like primordial prevention, primary prevention, secondary prevention and tertiary prevention, in all of these levels there are some modes we are following, okay, how we can prevent it. So, what are these modes? If we will conclude all of these modes which we have implemented in the levels of prevention. So, these are some of the modes by which intervention will treat any disease, will prevent the disease, okay. So, these are some of the interventions you can see. Interventions means treatment. First of all, any treatment we are doing, it is called intervention. So, there are 5 modes of intervention. First is the health promotion, okay. I think now you can tell me health promotion is under which level of prevention? Primordial, okay. Then another is your specific protection, okay. Specific protection is required only when a person is exposed. So, risk factors are present. This is under primary prevention, okay. I think this is clear to all of you. Then third is the early diagnosis and treatment. So, early diagnosis and treatment is a part of your secondary prevention, okay. Means the disease is present, we want to screen it early, we want to diagnose it early, want to start the treatment. Then disability limitation and rehabilitation, they are the part of the complications of any disease. So, we want to reduce it, this is under the tertiary prevention. So, these are the modes of prevention, modes of interventions we are doing in all of these preventions, level of preventions. I hope this, how they are correlated with each other, this is clear to all of you. This is a summarized chart for these levels of the prevention: primordial, primary, secondary, tertiary, the phases of the diseases on which they are targeting, what are these objectives of the levels, then what interventions will do, and what is the targets. You all know primordial prevention, it is for the normal people, okay, for the population, it is not for the patient, because risk factors are not present. Primary prevention, okay, this is also for the people, risk factors are present, but the disease, the person has not disease, okay. Then the secondary, the person has disease, so means here they are the patient, target groups are individuals with established disease, so they are the patients. Tertiary, they are all patients, okay. Interventions, I already told you what interventions will do. This is all the modes of intervention, okay. What are these objectives? We have already concluded in the previous slides what are the objective and what are the phases of the diseases, okay. Then there is one summarized chart here, you can see for the disease, impairment, disability and handicap. There are some events, okay. These events are accident, loss of food, cannot loss of means we will see the event, a person met with a accident, okay. In the accident there is a loss of food, okay, and if there is a loss of food, the person cannot walk, there can be a situation like this. The person cannot walk and that is why the person is unemployed, okay. So, these events, they are classified. Now, you can see the accident is a disease. Why they are disease? Because it is impairing the function of any person, okay. There is another event, due to the accident there is a loss of food. So, we will call it as an impairment when there is a loss of anatomical structure. So, there is a loss of food means the anatomical structure is lost, okay. So, there is a term we will call it impairment. There is another condition, due to the loss of food the person cannot walk, okay, the daily activities are compromised. So, it is classified as disability, okay. Now, in disability what we will interpret means the daily activities, the walking in a normal routine daily activity of a human being, okay. Then ultimately what would happen, the person is not able to go for the job, okay. So, that is unemployed means handicap we are seeing. So, loss is out of the job, person cannot walk, cannot survive cannot meet survival for the family members or for himself or herself. So, that is under the unemployment or under the handicap. So, these are all are the classifications for these of the events, these are the interpretations of these terms. I hope this is clear to all of you. We already have completed the concept of health and disease. Thank you so much everyone. I hope this is clear to all of you. We will meet in the next session.